Feeding your toddler. 5 common mistakes I see parents doing that you should avoid. Hi guys, I'm Dr. Eileen here. I'm a board-certified pediatrician. I'm here to talk about some of the most commonly discussed conversations and topics in pediatrics and to give you guys a behind-the-scene look on some of the things you may not get to at your child's doctor visits. Now, we're going to talk about feeding your toddlers, the 5 most common mistakes that parents make when they're feeding their toddler. Because I see this time and time again, and feeding literally causes so much anxiety, temper tantrums, because they just simply don't want to do what you tell them to do. So, and I want you to think about the content here as a source of education. In some ways, to think about how you're interacting with your child and how to do feeding times with your toddler. It's not meant for any medical advice or diagnosis. For those, I still recommend going to speak with your professional clinician, your pediatrician, and so that they can give you the most up-to-date advice that is specific to your child. Number 1 mistake that parents do is that there's not enough of a routine or structure when it comes to feeding their toddler. So you have to think about guys too when it comes to feeding, when it comes to sleep, when it comes to potty training or acquiring any new skills. They thrive on knowing when to expect certain things, when to know that they're going to be fed, when to know that they're going to be put to bed, when to get ready for school. So it's really important as a parent, when you're trying to feed your child, try to incorporate a routine. So whichever works for your day. Sometimes it's easier to have, breakfast 2 hours after you wake up, or it's like the first meal you want to start it right after they wake up and have their first cup of milk or beverage. So it's really important to kind of set that routine so your child over time knows, okay, it's getting to around dinner time, so I know this is separate from playtime and that I'm going to sit down and have a meal by myself or with my parents. Number 2, this last topic leads us to talk about mealtime as just that, mealtime and not playtime. So oftentimes parents will try to do anything to get their child to eat. They'll try to distract them and turn tablets on and have certain music or videos or have all kinds of toys on their food table, and the child just has too many distractions. So there's less incentive for the child to eat and just focus on eating. So I want you guys to think about mealtime not as playtime, right? Because playtime should be playtime. Playtime should be playing with blocks, playing with different things, and really just spending that quality time with a caretaker. But eating time really should just be focused on eating. So you want to make it very clear that when it is mealtime, we're trying to limit any kind of distractions. So the American Board of Pediatrics actually does not recommend having any digital advice during mealtime. And especially for 18 months or younger, we don't recommend any digital or media time, screen time at all. So trying to eat basically when everyone is ready to eat together, mealtime together, the family always helps. But if you're not able to do that because of your family schedule, that is okay too. But you want to make sure the mealtime is very clear that we're just going to do this. Here's what I'm offering for you, and we're going to eat together. Number 3 most common mistake that parents do is that they call foods by food groups instead of just what they are. Now, I see this happening a lot, and I don't think anybody even intentionally is doing it to label any food as a food group, but I think we're just conditioned to say, oh my gosh, my child's going to eat a vegetable. Let's talk about this vegetable. So for an example I want to give you, like if you're feeding your child green peas, just say that we're going to have some green peas. No, what are green peas, mommy? Well, you can say green peas are these little round, little delicious peas, and they're little baby peas and mommy peas. Some are smaller and bigger, and they taste delicious, and I want you to try them. I use this as an example because there's so many ways that we can talk to our children about foods. To a child who's never had a certain food, they're not in their head thinking, oh, this is automatically going to be something I don't like unless they try it. But they may have certain associations. So if they're thinking that all vegetables are not tasty and you call a new vegetable a vegetable, then they're going to think, oh, I'm absolutely not going to like it. But if you're just giving them the food as what they are and you describe the food instead of just calling it by this is a fruit, this is a vegetable, this is a green leaf, or this is a root vegetable. That way I think your child will have more curiosity in taking on or trying on a new food that may be green or maybe orange, but they'll be more open-minded to it. Number four mistake that I see parents doing is that they're offering their children special foods or too many options. So again, when you're offering your child a special plate of food that's different from what everyone else is already eating, you're kind of signaling to your child that they get special privileges when it comes to food. You're also setting this expectation, which is whatever your child wants to eat, you'll make it for them. So instead of doing their special play, like only make certain foods that you know they will only eat, try to offer them whatever that you're planning to eat as a family or whatever you're trying to eat as a parent. Your child generally looks after you. They want to emulate you, they want to copy you. You'll be surprised how much they want to do whatever you're doing. So whatever you're eating, trying to set the expectation pretty clear. You're going to eat what we're going to eat, but I'm going to give you and serve them in smaller bite sizes so that it's easier for you to digest. So try not to offer too many options and try to avoid giving them their special plate. Just make one plate of things that you're already making for the whole family. Number five most common mistake that I see parents doing is chasing their child around and trying too hard to get their child to eat. And now this comes several ways. Sometimes the parent feels that the child hasn't eaten much of the food at all. Well, I do think that all our children do have some internal regulators on knowing when they are full. And how much they're eating of certain foods may not be absolutely our idea of how much is enough. Remember, when your child is growing, they're going through periods of growth spurt, and sometimes they slow down, sometimes they get through another growth spurt. So sometimes their appetite increases, sometimes it decreases. Some days we're hungrier than others. So if your child is showing that they have tried a new food you put in front of them, but they're just done, not interested, they want to go play, that is okay. I would say just let them go and just start rocking around. It is not your job to go follow them around the whole house with a spoonful of food, hoping that they will take 2 more bites. That is unnecessary. It is too stressful. It makes it seem like you're just coddling your child around or chasing your child, and child is totally in control right now, and you're losing that like parent power. Like this is the expectation. We're gonna do this, we're not doing this. So remember, if your child is done and they have tried, if they've eaten something or picked at something, that's okay. Actually, I think that's great. They ate something that you put in front of them. That's great. But if they're not willing to eat the whole amount that you put in front of them, that's okay too. Because some days they'll be able to eat more than you put, and they will request for more foods. So be a little bit flexible and just take a step back. If they're honestly not interested in eating at that point, that's okay. Just put the food away and wait for your child to signal to you when they are hungry again to offer what you have made. So there you have it. These are 5 common mistakes that I see parents making all the time. Please do not do them. Please avoid them. Remember, this is meant to be an educational video. It's not meant for a medical advice. I think every child, every family, every situation is very personal and very different. I hope that this will help you feel more empowered in dealing with your picky eater and your toddler as you are getting started on your feeding journey. Have a great day. Thanks for tuning in. Bye.